my name is Sarah Stock and I'm an MSN student at Eastern Kentucky University. I would like to share a concerning healthcare problem and the proposal of an evidence-based intervention. An emerging healthcare problem advanced practice nurses will encounter is depression among adolescents. Depression is a common, although serious mood disorder caused by a combination of genetic, biological, and environmental factors. National and global support from organizations such as the World Health Organization have developed goals and resources to support depression in adolescents and illustrate importance, reporting half of all individuals who develop mental disorders have their first symptom by age 14. The purpose of the project is to focus on adolescents diagnosed with depression and determine how incorporating cognitive behavioral therapy, or CBT, compared to treatments as usual would affect depression symptoms within 6 months. The title of the project is Depression Can Be Treated with CBT. The target audience includes adolescents aged 13 to 17 with a legal guardian's permission to participate and who have been clinically diagnosed with a depressive mood disorder from a previous psychiatric evaluation, which medical records will be obtained and protected. This target audience was chosen because major depression notably affects adolescents in the United States, whereas the National Institute of Mental Health reported in 2015 an estimated 3 million adolescents aged 12 to 17 experienced at least one major depressive episode the previous year, representing 12.5% of this population. Therefore, the significance of the problem requires advanced practice nurses to be familiar with diagnostic tools and the treatment methods, along with noticing symptoms. The prevalence of depression among adolescents also indicates that most advanced practice nurses will encounter regardless of their specialty. The evidence-based proposal incorporates an integrative review search, and 4 studies were selected that highlighted the criteria of the clinical problem and intervention. In conducting a synthesis of the 4 research studies chosen, Emsley et al. 2015, Jennison et al. 2014, Belawaja et al. 2016, and Kobach et al. 2015 had several similarities and strengths, including they were all randomized control trials, study designs. The inclusion criteria included a sample population of adolescents under age 18, and based on the synthesis table that was conducted, all has a CBT-based intervention. Gaps in the literature included independent replications are required to minimize the possible attribution of the previous findings and a better understanding of why some groups of participants responded better to the program than others, along with a longer follow-up period of evaluation to determine long-term effects of treatment. Overall, all 4 studies contributed to the evidence-based knowledge of implementing cognitive behavioral therapy as an intervention for adolescents with depression and therefore add great value to nursing practice. In addition, it is essential to note there are an abundance of additional relevant articles that establishes the positive impact of implementing CBT as an intervention to improve depression symptoms in adolescents. The proposed intervention plan was developed to determine the effectiveness implementing CBT as a primary intervention had compared to treatment as usual. The participants were initially recruited using flyers and pamphlets that were available at local mental health outpatient clinics and inpatient acute psychiatric facilities for children and adolescents. The appropriate participants and families volunteered and were selected based on inclusion criteria and exclusion criteria, including age restriction under the age of 13 or older than 17, individuals currently in an inpatient mental health facility during recruitment or treatment, experiencing acute psychosis or suicidal ideation, and a diagnosis of schizophrenia or an eating disorder. Next, the proposed intervention would be discussed with participant and guardian, and an informative video would be required for adolescents to view on the proposed intervention and procedure details. Excuse me. An age-adjusted information is an effective method in the younger subjects. Participants will be randomly selected into 2 research groups. The independent variable group will receive CBT sessions with a trained healthcare professional for an hour weekly for the first 2 months and then 2 additional bi-weekly sessions the third month, compared to the control group who will receive treatment as usual for the 3 months. The CBT sessions would be completed in small groups, considering the study will have 80 participants total, and very weekly, integrating cognitive, behavioral, interpersonal, and family therapy, along with the participants responsible for outside assignments and to keep a journal to track progress. The proposed project will take place in a mental health outpatient clinic in Kansas City, Kansas, and there will not be incentives for participants. The proposed plan for evaluation starts with an outcome that is measurable, which is a decrease in depressive symptoms, and can be measured through a screening tool called the Beck Depression Inventory 2, or BDI-2. The BDI-2 is one of the most popular scales for evaluating depression in adolescents. It's a 21-item self-report inventory designed to assess the presence and severity of depressive symptoms. Each item is rated on a 4-point scale, rating 0 to 3, based on the severity of the symptom within the last 2 weeks. The results will be based on this scoring system, along with the Convex Alpha for measurement of reliability of the study. The BD2 will be administered prior to the CBT intervention for a baseline score, after the 3-month intervention for post-treatment results, and additional 3 months follow-up to determine the extended effects of the intervention. In conclusion, the purpose of this presentation was to introduce and show support of the evidence-based intervention of implementing CBT to help adolescents suffering from depression. Thank you.